Prevention Access Campaign,
or PAC,
is a health equity initiative
to end the dual epidemics
of HIV and HIV-related stigma.
PAC's Undetectable Equals Untransmittable,
or UequalsU movement,
is a growing global community
of HIV advocates,
activists,
and researchers
uniting to clarify and disseminate
the revolutionary but largely unknown fact
that people living with HIV
who are on treatment
and have an undetectable viral load
cannot sexually transmit HIV.
UequalsU continues to share messaging
to dismantle HIV stigma,
improve the lives of people living with HIV,
and is bringing us closer
to ending
the epidemic.
However,
according to the CDC,
there are currently an estimated 400,000 people across the United States who are not yet virally suppressed.
Some are not yet diagnosed.
Some are not engaged in care.
And others have co-occurring conditions.
Systemic factors like
racism and anti-blackness,
classism,
xenophobia,
transphobia,
homophobia,
ableism,
ageism,
and HIV stigma also prevent people from reaching viral suppression.
The coronavirus pandemic
has also disrupted HIV prevention
and care efforts across the United States,
leaving many people needing to be linked or re-engaged in care.
The good news is
that there are people like all of us,
you included,
who genuinely care about the well-being of all people living with HIV.
And will continue prioritizing people living with HIV
to ensure that everyone who can is able to reach viral suppression
and live overall healthy
and joyful lives.
Ensuring that all people living with HIV can benefit from UequalsU,
and that we can actually see an end to this epidemic,
will require individual, systemic, and social change.
Such change will require coordinated efforts from cross-sector partnerships
between public health organizations,
healthcare institutions,
the private sector,
aid service organizations,
community-based organizations,
advocates,
people living with HIV,
and our allies.
Which is why
the Prevention Access Campaign
is launching a new
US-based initiative,
The Journey to 400,000.
The Journey to 400,000 is a national public health initiative
to increase viral suppression among the estimated 400,000 people in the United States living with HIV
who are not yet virally suppressed.
This will be accomplished through innovative testing and treatment initiatives, education and trainings, outreach, awareness campaigns,
increased activism,
advocacy efforts,
and toolkits to collectively strengthen the HIV workforce.
The Journey to 400,000 will impact all steps in the HIV care continuum.
From ensuring people are aware of their status, to innovative care linkage practices,
to care re-engagement for those who have disengaged,
and treatment adherence support.
Ending the HIV epidemic is going to take all of us working together.
Which is why today, the Prevention Access Campaign invites you to join us.
Join us on this journey that prioritizes
all people living with HIV.
Join us
on this journey
to ending the HIV epidemic
once and for all.
Join us
on this journey
to 400,000.
Join us on the journey to 400,000.
Join me on the journey to 400,000.
Join us on the journey to 400,000.
Join us on the journey to 400,000.
We can end this epidemic together.
This is why you should join me on the journey to 400,000.
Únanse en esta jornada de los 400,000.
For more information, email us at jt400k@preventionaccess.org.